Hello, good morning. I'm Goncalo Pinto. I'm lead for practice development and transformation at FIP. And I would like to start by thanking you for the opportunity to contribute to this debate and with an international overview on pharmacists' prescribing authority for vaccines. I understand that you are familiar with FIP, but just to refresh this presentation by starting by saying that FIP is the global body representing pharmacy practice, pharmaceutical sciences, and pharmacy education. We have 151 national organizations since our last council meeting in Seville. This includes organizations from over 100 countries around the world, and FIP is the global body that represents our profession at the World Health Organization since 1948. And to start with an overview of how pharmacy has been increasingly involved in vaccination, and particularly with pharmacy-based vaccination, FIP started monitoring this service and this role by pharmacists a few years ago. The first survey we conducted, a global survey that we conducted on the role of pharmacists in vaccination, was in 2016. It was only 6 years ago, but it feels like a really long time ago because of all that happened since then. And at that time, that survey identified 16 countries around the world where vaccines could be administered at a pharmacy. This includes administered by a pharmacist, but also by other healthcare professionals. So you can see the map in 2016, and then we ran another survey in 2020. And at that time, already 36 countries were identified that had pharmacy-based vaccination. And then we conducted a new survey in 2022, and this identified a number of other countries. And since that survey, that we conducted in 2022 and combined also with reports on the media and reports from our member organizations, we now have information about 48 countries where pharmacy-based vaccination services are available. And you can see on the right a list of the countries that have introduced pharmacy-based vaccination since 2020. Some of them as recently as 2022, such as the case of the United Arab Emirates or Romania, for example. And of course, the pandemic had a lot to do with this and an important role that pharmacists played during the pandemic and vaccination. But let's start by identifying 4 broad elements that support this role by pharmacists in increasing vaccine uptake. So we identified, on one hand, stakeholder engagement, acceptance, and recognition, and this includes government support and also the acceptance and recognition by other healthcare professionals, and particularly those that have had this role of administering and prescribing vaccines traditionally, such as general practitioners or nurses in some countries, but also the support of the public, which is crucial. Another important element is, of course, education and training and certification of this competence to administer vaccines or to be able to prescribe vaccines. And this includes, of course, education and training for pharmacists, but also the availability of guidance for pharmacy-based vaccination services, guidelines in terms of the service itself and certification of this competence. Another element, of course, is logistics, and this includes the supply chain of vaccines and also storage elements. And we saw with the new mRNA vaccines, for example, how important the cold chain can be. So pharmacists need to be prepared and have the right conditions for that. But it also includes the logistics of the space within the pharmacy for administering vaccines, and also to manage possible anaphylactic reactions and or any adverse effects. And fourthly, and I've left this one for the last, but it's probably the one that is most relevant for this presentation today, and a key element to initiate and to provide these services is, of course, the regulatory framework and the policy to support these services by pharmacists. And this includes legislation to allow pharmacists to vaccinate, but also prescribing authority access to patient records and to vaccination records, and also the expansion of vaccine range that can be administered at pharmacies, but also the age groups, for example, that can be vaccinated at a pharmacy. In addition to these policy elements, we have the financial and the remuneration policies that uphold the vaccination by pharmacists and these services. And this includes, of course, the establishment of remuneration models for the service, but also issues such as the equity of remuneration for vaccination services compared to other providers, and other elements that uphold the service. So all these need to be in place for pharmacists to be able to provide these services. And in terms of now focusing on the prescribing authority of pharmacists, and we are borrowing this definition from the National Alliances of State Pharmacy Associations from the United States, but it's actually a very generic definition, which is that pharmacist's authority to prescribe vaccines and or administer a vaccine without a patient-specific prescription from another healthcare provider. This is self-evident, but it's important to use a definition that we can all understand what we are talking about when we are talking about prescribing authority for vaccines. FIP is a member of a coalition or a group of organizations that are beyond the scope of pharmacy, which is called the Immunization for All Ages Initiative. And this includes the World Federation of Public Health Associations, the Confederation of Meningitis Organizations, the International Federation on Aging, the International Longevity Center in the UK, the Shot at Life Initiative of the United Nations Foundation, and this initiative is supported by Pfizer. And this initiative has issued a manifesto and several position statements, and one of them that I would like to highlight is the one on expanding capacity for immunization beyond infancy. And this position paper, the second point, includes a recommendation for governments and stakeholders to promote the expansion of trained healthcare professionals as vaccination providers by eliminating the requirement for a medical prescription for vaccine administration when clear eligibility criteria and protocols have been developed for each vaccine. So you can see that this is not just pharmacists advocating for this point, but there's a whole range of organizations that see the immediate benefit of having pharmacists having prescribing authority for vaccines. And in fact, the prescribing authority for vaccines is not just about the role of the pharmacist, but mostly about simplifying the patient journey to get vaccinated. So when there's no such authority, then a patient needs to become aware of the needs and the benefits of the vaccines, and this can be done at the pharmacy or from a GP or from a nurse, for example. But then when the patient decides to become vaccinated, they need to go and get a prescription from a general practitioner normally. Then in many countries or in many parts of the world, they need to go back to the pharmacy or go to the pharmacy to have the vaccine dispensed. And in many cases, they need to go back to the general practitioner or a nurse to have that vaccine administered. Whilst when the pharmacist has the prescribing authority for vaccines based on protocols that are very clearly establishing the eligibility criteria and the circumstances in which pharmacists can prescribe and administer that vaccine, this whole convoluted journey becomes a one-stop shop for this entire process. And it's not just a matter of convenience, it's a matter of not losing out all these patients that we might do so because they think that the journey to become vaccinated is so complex that they just probably don't take the effort. And especially when we think of older patients that may have mobility issues or have they just don't have the availability or the willingness to go through this complex journey. So FIP has just published a report recently, a guidance for pharmacists document on optimizing vaccination through the co-administration of influenza and COVID-19 vaccines. This is based on guidance from the WHO. And a technical experts committee of WHO has stated that the co-administration of these two vaccines in the same session is perfectly safe. So again, it's an opportunity to harness the visit of a patient to the pharmacy to administer the two vaccines and improve vaccination coverage for the two vaccines and for both respiratory conditions, influenza and COVID-19 vaccines. So we really need to address convenience of vaccination if we are aiming at improving vaccination coverage. So this is incredibly important. I'd like to focus now and present some data from a survey that we conducted in 2022 and that I referred to before. This survey was specifically focused on three vaccines or three areas, and that's the Tdap vaccine, tetanus, pertussis, and diphtheria, but also the COVID-19 vaccines and meningococcal vaccination. But although the focus of this survey was these three vaccines, we did ask countries about prescribing authority for other vaccines, for example, but just in less detail. So I'd like to present some findings from this survey. And we could see that, to start with, we see that there was an increase in the number of countries that have granted prescribing authority for vaccines to pharmacists since our previous survey in 2020, from 11 to 18 countries. And this was greatly linked to COVID-19 vaccination, of course. Please note that the 2020 survey was conducted at the very beginning in January of the year, so this was before the pandemic. And what we see here is, as you can see, for the DTP booster vaccination, we have 5 countries that have pharmacist prescribing authority. For COVID-19, we had 11 countries. So definitely there was a policy element here that allowed pharmacists to prescribe and administer these vaccines as part of a mass vaccination strategy. But also for meningococcal vaccination, there were 4 countries that have where pharmacists have prescribing authority. And for other vaccines, and unfortunately we do not have details of which other vaccines these includes, but there are 11 countries where pharmacists have prescribing authority for vaccines. And in most cases, this includes the influenza vaccine, but it does include other vaccines in some countries as well. And what we see here, for example, some data on the impact that pharmacists had on COVID vaccination, with, for example, in the United States, pharmacists administered over 256 million doses of the COVID vaccine. In Canada, 17 million. In Ireland, 750,000 doses. UK, 22 million. Australia, 7.5 million. France, 20.5 million. We see these countries, the ones that have the green tick on them, are those where pharmacists had the authority to prescribe and administer these vaccines. And we see these huge figures and the great contribution that pharmacists had to improving vaccination coverage and reaching out to more people. So definitely makes a big difference. Some data from that survey as well. We can see per region. In the European region, we have 8 countries that had COVID-19 prescribing authority, and 1 country where pharmacists have authority to prescribe for diphtheria, tetanus and pertussis vaccination, and 1 for meningococcal. Some parts of the world, like the Eastern Mediterranean region or the Southeast Asian region or Africa, prescribing authority is practically inexistent. I invite you also to visit the Global Pharmaceutical Observatory, where you can see in an interactive way a map where you can click the questions or the issues that you're interested in and see a data visualization on this global map. Some examples, for example, in the United States, does the patient need a prescription for a pharmacist to administer a vaccine on the adult immunization schedule? And you see these 3 scenarios. The darker shades of blue is the states where pharmacists can prescribe, so a patient does not need a medical prescription. The medium blue shade is where pharmacists can administer the vaccine via a prescriber-approved protocol or a non-patient specific order. So in practical terms, there's a general protocol that allows pharmacists to prescribe vaccines. So it's not so different from the other scenario. And finally, there's a couple of states where a prescription is needed for certain vaccines or age groups or circumstances. But in general, in the United States, most of the states allow pharmacists to prescribe vaccines. And actually, during the pandemic, pharmacists were able to order, prescribe, and administer all routine childhood immunizations and COVID-19 vaccines to ages 3 and older, and also for influenza vaccines to ages 19 and older. In Canada, we see that also in the majority of provinces, pharmacists are authorized to prescribe vaccines. This is not yet the case in British Columbia, Manitoba, and Ontario, and also the smaller, well, not smaller in size, but in population, territories in the northern part of Canada, which are very scarcely populated. But also in Europe, we have a few examples. For example, in Portugal, pharmacists do not yet have pharmacy prescribing authority, but there was a pilot project in 2019 in a municipality near Lisbon, where the influenza vaccine was administered without the need for a medical prescription at pharmacies and without the need of out-of-pocket payment by the patient. And we saw a 32% increase in vaccination coverage in relation to that pilot. So this clearly demonstrates that when the conditions are there and these barriers are removed and lifted, that vaccination coverage rates increase. And finally, I would like to highlight the case study of France that have had a very quick progression from the introduction of pharmacy-based vaccination very recently, and in this year, where pharmacists actually, together with nurses and midwives, were authorized to prescribe and administer COVID-19 vaccines to children aged 5 to 11. This was in January, and in June, the High Authority for Health made a recommendation that pharmacists, nurses, and midwives should be authorized to prescribe and administer all non-live vaccines on vaccination schedule for individuals aged 2 and older. So France has had one of the most interesting and spectacular changes and quick developments in terms of vaccination authority for administering and for prescribing vaccines for a broad range of groups, and is clearly a very interesting case study within Europe and around the world. And this includes, for example, a monkeypox vaccination. The pharmacies were involved in the strategy for monkeypox vaccination in France very recently. So with this, I invite you to visit the FIP microsite and focusing on vaccination, where we have all our resources and publications and advocacy tools. And I hope that you found this presentation useful, and the best of luck for any expansion of vaccination prescribing authority over there as well. And thank you so much for the opportunity to present today. Goodbye.